You're watching Every Days and Saturdays, USCC veteran. Let's go, baby. And here's your host, Brian. What's going on, friends and family? Thank you guys so much for joining me on another great day, another great interview. I hope you guys are having an amazing 2025. And you know how we like to say on the show, don't let the day kick your ass. Make sure you're out there kicking it. And if you're having any struggles out there, remember, if you're a veteran, or even if not a veteran, there's a crisis lifeline. You just gotta press dial 988. Sorry, press 1 if you're a veteran, and it should direct you into the right area, get you some kind of help, put you in touch with someone that maybe you can just talk to, let them know how you're feeling, and maybe they can point you in the right direction of some resources. I've talked to several people who have used 988, and it has helped them. So don't be afraid to use that, and also don't be afraid to reach out to other friends and family out there. I myself, every day is a Saturday, 365 at yahoo.com. I'm always available to listen to you if you have any problems, and maybe I can set you up and put you in the right direction as well. I'm really excited for my next guest. She is highly certified. So if you guys are struggling with PTSD, depression, anxiety, trauma, abuse, military-related trauma, grief, insomnia, or chronic pain, or even sex issues, she is the one to go to. And I'm excited to have her on because I imagine everyone out there, I promise you probably have at least one of those going on in your life. So I'm excited to have Brooke Bralove on here. And that is how we say her last name, folks. It's Bralove. Don't go out there saying Bralove like I wanted to. I think everybody out there initially wants to, but she'll quickly correct you. Thank you so much for coming on, Brooke. And I know we've had some we had some little issues trying to get here, but we're finally here. So I imagine we're going to have an amazing show. And I'm so excited to get to know a little bit more about you and what brought you into your world of dealing with psychos, and people with all and people with all kinds of mental issues. And we live in a world with a lot of folks like that. So I imagine we need more people like you in that way. So let's get to know a lot more about you and what brought you there.
Well, first of all, Brian, thank you for having me. We had a couple reschedule. I think I screwed one up. I think you screwed one up, and here we are. We're neither of us is screwing up, so it's a good
Bada
day.
bing, bada boom. We had a little audio issue. We're like, oh gosh, I know she's just probably like this guy.
We solved it. So yeah,
That's
so I'm
right.
happy to be here.
Absolutely.
So my name is Brooke Bralove, and I'm a licensed clinical social worker and a psychotherapist. And I live just outside Washington, D.C. in Bethesda, Maryland. I, yes, have a lot of certifications, but mainly I am a master accelerated resolution therapy practitioner. Accelerated resolution therapy is also called ART, and I'm really going to get into that today. And I'm also an ASEX certified sex therapist, and I'm a certified Daring Way facilitator, which means I do the work of Brene Brown. I work with her shame resilience curriculum in a group setting, and I lead workshops for men or women, exploring really difficult stuff like shame and vulnerability and perfectionism and that kind of thing. But my new love is ART, accelerated resolution therapy, and I'm excited to talk about that. I've been in private practice for more than 20 years, and I love what I do. I came by it pretty honestly. Um, I struggled a little bit as a kid with anxiety, and I think I was 9 the first time I went to therapy. And I really found it to be something that was incredibly important and valuable to me. As I grew up and matured, I would go for a little, then I'd, be okay for a while, then I might go back a few years later. And frankly, I actually don't plan on ever kind of not being in some type of therapy because I find it that valuable. And it's really become a value of mine.
Mm.
And I am lucky enough to be able to afford it. So I want to make a massive caveat for sort of right away that therapy is expensive, and to get really good quality care, it can be, really unattainable, and something um, most people can't do. And I do talk to veterans, and TRICARE is a very difficult system to navigate. And so I don't always know that veterans are getting the kind of care they so desperately need. In fact, I imagine they often don't get it. I'm also, the VA. I mean, we're in Washington, D.C. There's a lot of VA, and, there's just a lot of military um, places sort of here. And I don't hear always the best stories about the best kind of care, and that concerns me. I will also just kind of disclose that I'm probably part of the problem because I am in private practice, and that's a choice I've made, and for my family. But I do like to own that because I'm not saying everybody is going to be able to find a practitioner like me. I am hoping that's going to change, and I do think it is changing, especially because art is now being offered um, at for different military sites, a lot of wounded warrior type experiences.
Mm.
So we art is definitely penetrating that system, but it's going to be slow.
Well, you got to start somewhere, right? And I think that for so many years, mental health is kind of always, it's always, mental health has always been there. But I don't think that we've put a lot of focus on it because it's one of those things that no one ever wants to talk about, right? Because it's the negative part. There's things in there that people don't want to talk about. It There's shame in there. There's guilt.
Mhm,
There's a lot that comes with mental health,
mhm.
and so a lot of people want to just suppress it. And like a lot of us have been told all our life is to suck it up, move forward, and keep suppressing your feelings and don't deal with them. And and so we do need more avenues to to allow ourselves to speak, right, and to let out certain emotions and to feel comfortable about doing that without feeling the shame that usually comes from it.
Yeah, and I mean, you're absolutely right, and I wanna sort of touch on 2 points there. I mean, this is a military, audience mainly, and when we think, I'm not in the military, I have not been in the military, but when I certainly have worked with people who are veterans or, younger people even enlisted, and, you know, you guys are taught the antithesis of asking for help. So not only I'll speak about men, but since you were born, you've been socialized from probably as early as you can remember.
Right.
Boys don't cry. I'll give you
Mhm.
something to cry about. Um, you're too old for that. You know, Only girls cry. I mean, you name it, right? And
All
so
the suppression stuff, right, to keep yourself suppressed and allowing yourself to feel a certain way.
yeah, and we do it explicitly, some families, a lot of
Sure.
families, but
Right.
implicitly, it's just even, more
It's
widespread.
generational, right? I mean, it's just it gets passed on from generation. It's a cookie cutting experience. Like, this is how I was raised, so I'm raising my kids to be this way, and we just generationally keep passing it down. Correct?
Right, and look, I mean, we probably passed down some wonderful things generationally,
Sure.
but you're also talking about things like, abuse, neglect, violence, alcoholism, substance abuse, sexual, molestation, sexual assault, all
Yep.
those things. but also shame, guilt, and just plain trauma in general gets passed
Right.
along. So I want to name that I really think men and boys have it really hard. And I don't mean to say that, it's not a big cry fest for men, but I really want to acknowledge that if you were socialized as a man in this country and probably this entire world, you have learned that your inner world doesn't matter. Nobody cares what you're feeling, what's happening on the inside. You have to present a strong front and back. And then if you go into the military, I can't even imagine the kind of training you get on suck it up, power through, don't feel pain, don't be connected to your own body. You are literally taught to dissociate to get through the difficult things. And again, I'm not saying that's all bad. I understand that there are lots
There's
of
a
ways to cope.
necessity of it, right? But the problem is that they train you for all that. So they don't untrain you for when you leave. They train you to be a warrior. And so we do there is a level of training that we do need to have some kind of a, I don't know how to say it, but you almost need to be desensitized a little bit to some of the human feelings when someone gets hurt or dies or is maimed, all the things, screams, the things that all come with war and stuff like that. But
Mhm.
we're not meant to be warriors for the rest of our lives.
Right.
And we
That you're
have
absolutely
to
right.
get out, and they don't do a great job at disassociating us from that. And then when we want to go get mental health, we get put into months on months waiting for an appointment. So dude is struggling, dude or even a female is struggling
Mhm.
mentally, and they want help now, today.
Yeah.
Sorry, we don't have one for 90 days, and they just keep putting it out there. And then by 90 days, the person's already gone through and processed a lot of things, or it got worse for them, or whatever. It's just, that's the hard part. But now, even in the normal sector of the world, you go to try to get mental health, go to Kaiser. They have to give it off to other people now. They don't even have enough people in the mental health department to field what's going on in today's world, especially after 2020 COVID. That
Yeah,
really spiked up the mental health departments and really flooded them. And it's making it hard for the people out there that are in really deep suffering, right? Veterans, combat
absolutely.
veterans, and things like that, or anybody that's been seen through some main suffering, and then they get thrown into this waiting line that sometimes is months on end, and some of them don't even make it to that date,
Right.
right? That's hard.
Yeah, it's a huge problem, and I think what's also important is asking for help is very courageous. It's very brave. And actually, Brene Brown's research shows that nothing builds trust more between two people than asking for help. So, asking for help is a courageous act, it's a connected act. But if you ask for help and are told, see you in 3 months, first of all, most likely you won't even follow through. You'll hear that and you'll give up right away. I mean,
Right.
maybe you'll make another call or two, but most people won't even stay in that 30, whatever 30 day, 90-day sort of line or queue. And so I also think what's happening is we're missing the boat. We're missing people when they're actually, as you said, like in desperate need. And all we have is a 988 crisis lifeline. And that's wonderful that we have that. It's really incredible.
I've gotten
But,
mixed reviews about it, right? I've heard good stories and I've heard horrible stories. So And I guess that it matters where call center you get connected to and things of that nature. Same thing with the VA. You
Yeah.
hear great stories of the VA and you hear horrible stories.
Yeah. Yeah. I mean, it's not again, it's just it does depend on, who you get to talk to and what their training is. And I'm glad we have it because I do think it's a bit of a safety net, but I mean, it's not the same as comprehensive mental health treatment.
It's
So I
definitely not a fix. It's something to hopefully, it's another avenue, right? At least for someone to take and to hopefully not go down the wrong path.
Right. Yeah, exactly. And so I think, in general, I think what I do think is improving is I do think the stigma around mental health is decreasing
Sure.
slowly but surely.
Right.
That is a fact. I
And
have two
awareness.
teenage girls, and that their friends are always like, my therapist says this, and oh, I go to therapy, don't you have anxiety? So I do think some of that is changing, and I will say I get very excited when I hear that because when I was a teenager, that's just not how it would go.
Right.
you know
Correct.
eh,
Yes.
um so I'm excited about that, but again, access is a nightmare. And people will call me. I don't take insurance. And people will call and they want to use their insurance. And, I'm a social worker at heart. So when I get a call, no matter what, even if I have absolutely, this isn't the right fit for me, or if someone immediately wants to use their insurance and I don't accept it, I will take time to find them a proper referral. But my colleagues don't accept insurance. So it's very difficult actually to refer them to someone I know either personally or professionally. So I'm on there, looking at the listservs and the, Psychology Today profiles, trying to see if I know anyone who accepts insurance. And so it's a problem, and I don't know how it's gonna get better because, you really don't make enough to make a living, accepting insurance, and you have to work twice as many hours. So, I think
So is that kind of the con, I guess, in taking insurance is you're dealing with double the patients, but at less of the cost?
a
Yeah, right.
quarter of, a quarter
What you'd be
to a third. Yeah. I mean,
sheesh.
frankly, yeah, and depending in the market, but yes. And look, I mean, you know, we burn out, right?
Sure.
We burn out, and I know that part of my not burning
And there's
out.
no way you could be an empath doing this kind of job. Because
Right.
I mean, taking on all that and listening to everybody and being an empath, that would be a really rough. I mean,
Well, we actually are empaths, but we've been taught how to have boundaries. So I actually
mm,
think uh, I would argue that almost all of us see ourselves as empaths, but we are empaths with boundaries. So we're not the kind of empaths who have the sort of
carry it, take it
the
on.
sensitivity where we take everything in. Then we could never be a good therapist. And I
Right,
know
because you
some
walk
people like
away with
that.
a sad story and it ruins your day, and you have other, patients that would ruin it, right? I mean,
Yeah, and you have a life and you wanna go home to your kids, so I
sure.
actually think that's why we're helpers and healers, because we are empathic with very clear boundaries.
Mm,
Because I cannot help you if I am in it with you. If I'm in the hole with you, that's not what true empathy is, and so I gotta
right.
stay outside the hole and help you while you're
Great.
in it.
To someone to at least put the hand down there, right, and reach down.
There
Yeah,
you
because if
go.
you're right, you're down there with them, you guys are stuck in the hole.
Right, then nobody's an expert and we're all in it, and you don't pay for that. So,
Makes sense.
yeah, but I think we're all doing the best we can, and there is no doubt that during COVID, no one had openings. I mean, it was awful.
Just packed.
Yeah, I do think that's
What was like the
changing now.
age range too? A lot was there, you starting to see a lot more children coming through than
Mhm.
I mean before. I mean, because I felt like COVID kind of really spiked the children mental health epidemic.
Absolutely. I mean, developmentally, we absolutely know kids suffered greatly. And I
Mm.
think at different, developmental milestones, my kids kind of actually skated through a little bit. I lost complete control over the phone. Um, that was it was sort of because, you couldn't say, I'm
Well, at
taking
that
your
rate in
phone.
time, it's hard, right? Because
That's all
I
there
think a
was.
lot of parents lost control over the technology with the iPads and things like that. And what do you say? Because now that's their way of socializing, and the only socializing that some of them were only getting, right? I mean, thank God
Yeah.
they could FaceTime and see some of their friends, right? I mean,
It was all we had, and yes, I am not alone in the losing complete control of the
no,
phone.
you're not alone. You're definitely not. Yeah, I could say the same.
Yeah, yeah. So, but I'm happy to kind of jump right into talking more about ART if that works for you. All right.
let's do it.
So, um, ART or ART or accelerated resolution therapy, you can call it whatever you want. Um, it is not at we are not talking about actual art therapy. There are no, markers and crayons, and sometimes people get really confused when I'm talking to them, and they're like, "But when are we bringing out, the paints?"
Because
So
if you say crayons around Marines, they're just thinking they want to eat them right away too. So,
there you go. There you go. So anyway, basically, art is an evidence-based treatment modality that uses rapid eye movement and something called voluntary image replacement to change the way the brain stores distressing images and then the corresponding negative sensations that show up in the body when someone is triggered.
wow.
So, art is amazing, and it's the most exciting thing I've ever done in my career. It has breathed complete new life into me as a clinician, into my practice, into some of my long-term patients, and so it's really exciting. And it really, sort of the goal initially was to help veterans with PTSD. And the most research we have shows that it cures PTSD symptoms in an average of, I think it's 3.4 sessions. So,
Wow.
art is very brief, it is not meant to be long term. Usually, what we say is art is 1 to 5 sessions. If it's a single incident
When you say a
trauma.
session, how long's a
Mm.
session?
So people are a little bit different. I do 90-minute sessions
Okay.
for art. A lot of people, again, due to insurance confines, squeeze it all into 60 minutes. And I
Mm,
used to do that, and I don't like the way I feel or
mhm.
because I am rushing them, and that feels terrible to me, right? You can't rush someone's trauma or their process. So I have the luxury, because
Makes
I don't
sense.
accept insurance, to do 90-minute sessions, but certainly many, many clinicians all over the country are doing it in 60 minutes, and they're doing a great job. They've just figured out, how to do that, and I never did, I guess. Um, so, 1 to 5 sessions for single incident trauma, like a shooting or a car accident, something like that, usually you're looking that it will only take 1 to 2 sessions. Single incident trauma is the easiest to treat because you're not treating
And you
multiple
kind of
traumas.
right, yeah. And you kind of have the you have the symptom to kind of hone in on, right?
Yeah, and you have
Or
kind
the
of
issue.
a beginning, middle, and an end to their experience. And so, I'd love to tell you how I came to know about art because,
Yeah,
again, I
absolutely.
I came by it very
I've never heard about
honestly.
it, so this is great.
Yeah, yeah. And, so I came about it because I had a terrible, terrible breakup in 2017, and I just could not get over it, and
Mm,
I did my usual, twice weekly. I mean, I amped up my therapy. I did some yoga therapy. I mean, I threw the kitchen sink at my grief, basically, and my stuckness, and nothing worked. And then someone randomly said, "The only other thing I can think of is there's something called accelerated resolution therapy." And I said, "Give me that number, I'll try anything," because I was pretty desperate. And I went in and I did the art protocol. I did 3 sessions, and I absolutely 100% was over this breakup. I could function completely normally again, and I moved on with my life.
you were able to detach from the feelings.
Completely detach so that my feelings, I could tell you all the facts of this relationship. I could tell you exactly, what the person said when he broke up with me, but I had none of the feelings attached to it. And
Mm,
I didn't have the images that were traumatizing, like the way he looked when he, shook his head and said, "No, we're not going to stay together," or whatever. Um, and those things are often what haunt us. So, the thing about trauma that it was really important to know is it is not necessarily what happened to you, it is the way your nervous system processed the event
mm.
and then how that sits inside your psyche,
Your
inside your
response,
body.
basically?
Exactly, right? And we know this, right? Because 2 veterans can go through the exact same experience and have very different outcomes, right? One
Right.
has PTSD, one, manages to move on, move forward with not a lot of, maybe none, no PTSD symptoms. So we know that it's how someone processes an event, not necessarily the event itself. And that's
Mm,
important. But what we find with art is that, again, it's not what happened, but it is the intrusive images that when one thinks about, one will get, have a nervous system response. So, if I think about before art, if I thought about the day he broke up with me, I might get a lump in my throat and I might feel nauseated and I might be shaking. And so, what art does is we treat both the images and those corresponding negative sensations. And that is what we find is really curative.
mm.
So,
It kinda works the same way with grief, I would imagine, like, if you lost a loved one, I mean, it would be
anything,
'cause, I mean, you breakups could be some almost like grief as well, right? Like, like a
100%.
death of someone, I mean, it's a
Yes,
lot of depending on
and
how invested your feelings were, right?
oh, yeah, absolutely, and it does, art works incredibly well for grief, and, I can give examples, but what I wanna sort of say is, first of all, just the history. So art started in 2007 by
Mm,
a licensed marriage and family therapist, Lainey Rosenzweig, and many people have heard of EMDR, which is a kind of, I call it like a distant cousin to art, but it's more well known. It's been around since the 70s. It's eye movement desensitization and reprocessing.
mm,
And Lainey Rosenzweig basically said, "I can do better." And she fine tuned the eye movements and the protocol and came up with this, again, very clear protocol. So art has steps and it has a beginning, a middle, and an end.
mm,
And what's great about it is that the reason it's called resolution therapy is there is a resolution at the end of every session. So, unlike talk therapy or other therapies We don't open you up, have you think about the worst day of your life, have you feel all the negative sensations, and then say, "Oops, time is up. We didn't really get through it. Have a nice week." Right? Because we're just re-traumatizing the person and we're not helping them close it down. So there really is a resolution. Doesn't mean you might not need another session, but we always have a resolution, which means people feel better 98% of the time when they leave my office. And
Mm.
in fact, I can have someone having a complete and utter panic attack where they are not sure they can stay any longer. And 3 minutes later, they have a huge smile on their face and they might even be laughing. And that's how fast the process can look. It can take you from the worst day of your life to imagining a better outcome and storing that in the brain.
Well, obviously, right? You went from being a patient,
Mhm.
and you obviously it worked so well for you that you wanted to do it yourself, right? I mean, and so I mean, obviously, you felt very compelled by it, and I mean, not a lot of people that go through their treatment end up being the doctor, or you know what I mean?
Right. Yeah, no, I got trained as quickly as I possibly could. I mean, I was like, "Let's do this," you know? I wanna help people in 1 to 5 sessions because
Right.
I am a long-term psychodynamic psychotherapist. I see people for years sometimes, not always, but, it's not uncommon in long-term psychotherapy. I have a patient I've seen for 12 or 13 years, others I've seen for 8 or 6 or 5. So I do long-term work. I
Wow.
believe in the power of talk therapy. But
So
there
you
are
really get to
certain
know your patients a lot of times. I mean that's a long time with
Oh, I
getting to talk to someone.
Yeah, I mean, I love some of my patients that I've known. It's a relationship. It's a real
Sure.
relationship. I care deeply about them. I think about them. I'm boundaried about it, but we do care about the people we work with, and especially when it's that long term, right? But with art, I don't need to know your entire history. I actually just need to know what you want to work on and I don't even need to know the details. And this is what makes art
Mm.
so special. So, your comrades. Your comrades are not about going through and then this blew up and then this happened around me and then this friend died and then I couldn't do this and then we were in a bunker forever. They don't wanna talk about that stuff. They don't necessarily see any value in rehashing some stuff that already happened that they have no control over. And so why I love art is, first of all, it really appeals to men who don't wanna talk about shit anyway. I assume I can curse on
Oh,
here?
yeah, absolutely.
Okay.
Yeah,
So they
yeah.
don't wanna talk about stuff, but
No.
also traumatized people do not need to keep talking about their trauma. Each time you retell a trauma, you actually make the neural pathway in the brain a little bit deeper and stronger. So that's the last thing we
Mm.
want to do. We don't, so I don't want to hear much about why you're coming in. Now, I like to feel connected to the people I'm working with. So I usually do ask for kind of a paintbrush, stroke of what did happen. And they can tell me if they want to talk in the first intake session, they can tell me as many details as they want, but they don't have to. And then during the art session, the predominant way what you do most of the time is move your eyes back and forth, left to right, without any talking. That is the vehicle of change, is the
Wow.
rapid eye movements. And so we don't talk much at all. I may ask you, anything you want to share, or what sensations do you have in your body. I may ask you a couple questions, but mostly all the work happens in your brain and in your body, and we don't need to talk much about it. And
Wow.
so that appeals to a lot of people
Yeah.
because by the time they've come to me, they've seen, you know, a cognitive behavior therapist.
Yeah, they
They've
rehashed their story probably 30 times, right? And have to relive it, relive it, relive it.
right.
Yes.
And then I get to say, no, no, we're not going to do that here. But we are going to change the images you have, and we are going to make you feel neutral about what has happened. And meaning, and this is important in art, we say, keep the knowledge, lose the pain.
Hmm.
You will never ever forget the facts of what happened to you. That is part of your history, part of your life, and we're not messing with reality. This isn't hypnotism, this isn't trying to help people forget something. What we are trying to do is to take the sting out of all the feelings and then the reactions that keep happening, right? What is PTSD? PTSD is every time my husband walks behind me and touches me, I flinch and, feel like I'm being attacked, right? That is a PTSD response. We need to stop that from happening. We don't need to forget the facts of what happened to you when you were, um, uh, you know, in a war. That's not the goal. But we want you to lose all those traumatizing images, which many people who are veterans experience tremendous, intrusive, violent, terrible flashbacks that haunt them, that make them not want to go to sleep, that cause insomnia. Because if I know I'm going to see these horrible things over and over again, why do I even want to go to sleep? And then,
Right.
frankly, they happen in the daytime too, right? And so we get rid of we get rid of all of that, where you can just, if you had to, say the facts of what happened without the negative, feelings. And then most importantly, we want to stop you from flinching when your husband comes up to give you a hug. That's what's stressful. That's what's bothersome. It's what's happening today that we know is related to a past trauma. I want my husband to be able to give me a hug and I melt into his arms. Because of what happened on this day in my life, I cannot do that. And so art helps with all the current symptoms by using rapid eye movement to calm negative sensations in the body while we desensitize the person to the scene that occurred, the incident, and then replace it with the way they wish it had happened. And that's what we do in art. So we're storing images that are more positive and the way we wish things had happened.
And will that ultimately help them with the reactions and or response to that same kind of trauma instead of, you know, like for instance, for me, like booms and bangs, sometimes I almost want to hit the floor, or something of the sort, and feel like I jump out of my body there for a second. Now, is that you help people with that response to what's triggering them, or what exactly?
Absolutely. Yeah. So we would go through, if in your case, what we would probably work on is whatever incident that has occurred or training or whatever it is that caused you to hit the floor or, and maybe it was multiple, I don't know
Yes,
your history, right?
multiple, right?
Okay,
Yeah.
so right, multiple
Because
chronic.
we had Scud where where I was in Kuwait, we were taking a lot of missiles and having to run and react to, constantly to alarms, Scud alarms, and sometimes there was real ones and sometimes there wasn't. I mean, so it's just a constant. And so now,
You're
booms and
hypervigilant.
bangs, yes,
Mhm.
yes,
Yeah. So one of the best things, what I love about art is it helps with hypervigilance, right? So you had to do that. And again, this yours is not single incident trauma. It happened over and over and over again,
right,
right? You had to
sure,
do that
yes,
over and over and over again.
yes, very
And
repetitive.
right. So I would have you imagine a montage of all those times you had to do that. And when you imagine that in your brain while you're doing rapid eye movement, I would imagine your heart's going to race, or again, you might feel flushed. There'd be some negative response as you're imagining and remembering all those experiences. But the rapid eye movement slowly calms those negative sensations.
Hmm.
And then we would replace it with the way you wish it had happened. You went over there, maybe it was a peaceful mission, none of those things ever happened, or maybe you would turn every single one of those booms and bangs into balloons popping at your child's birthday party. So
Hmm.
you get to change it any way you want. If you want to associate that loud thing with your favorite rock concert, then that's what you would store in your brain. And as you did that, as you imagine your favorite rock concert with all those booms and bangs, right? And you're
You're over there headbanging as you're hearing them now.
headbanging. There you go. What we'd imagine and what does happen is you'd start to have positive sensations in your body. You'd be like, yeah, this is the best concert ever. And maybe you'd feel butterflies in your stomach in a good way, or excitement, or chills. And then we would just have you store all of that and those positive sensations. And then we would actually help you practice. We would have you imagine the next time you're in Walmart and you hear a bang and a boom and you want to hit the floor. And we would practice that until you no longer have negative sensations when you imagine that. And then guess what? The next time that happens, you're not going to do anything.
Hmm.
You're just not.
Now, when you guys do the the eye movement, how do you guys get someone to do that? Do you have like
Mhm.
a laser or a pen, or is there
Great
an instrument?
question.
Mm.
Yeah. So in art, we're actually trained to just use our hand, meaning I would raise my hand in front of the person and they would literally keep their head still and just look left and right, left and right. I can't do that with my body. My shoulder would fall off. So in my office, I have a light bar. And again, it just moves back and forth. And the person just follows it.
Nice.
And art is equally effective virtually, which means you can do it from anywhere at any time. And with that, we have like a program, or a website that simply has like a blue dot on a gray background, and it just goes back and forth, and the person would sit close to their screen and move their eyes back and forth. It's
Wow.
not magic. um Again, it's not hypnotism. There's exactly what's happening at every moment.
There's got to be something though that with the eye and the brain, right?
Yes.
In the way that works. There's got to be some kind of a correspondence, obviously.
Yeah, yeah, we have the science, and what the science says is that um when that bilateral brain stimulation and bilateral eye movements replicate REM sleep, right? What do we know about REM? Your eyes go back and forth, right? That's how we often figure out, in sleep studies, whether someone's in REM sleep, is we look at their eyes. Well, in REM sleep, that's when memories are reconsolidated. That's when we like update the brain with memories. So if we do that while we're awake, then we're basically creating that change, but we're having control over it. We're not letting it be like, and then that terrible thing happened, and we'll just cement that into our brain. We're changing it while you're awake so that you actually have control over what happens with that memory. The other thing that we know is that when you get the left and the right brain talking to each other at the exact same time, which rarely happens because we
Right.
use one or the other,
Sure.
you get problem solving and creativity. And that's what art requires: problem solving, and then this creativity that comes when you create this incredible new, better scene. And that is amazing. And let me tell you what I love most about that. Someone can come in. I had someone come in and she was like, I just don't know what to do about this job. Like, I just literally don't know. Should I leave the job? Should I quit? Should I stay? Like, whatever. And I was like, well, do you want to just do some eye movements? And, we did like kind of almost like a little mini session of art. And at the end of, 15 minutes, she was like, oh, I'm totally going to leave my job. She was never going to come to that anytime soon. But because we had those 2 parts talking, it's like the truth rises to the top, truly, is
Mm.
what it feels like. And again, I've been a patient of art, not just that one time, but a lot of times throughout, because that was 8 years ago.
So
And
yeah, definitely. So you've gone through it. You have someone that
I
you go to?
I do.
Yes.
My associate who works with me, I have 2 associates who specialize in art because I wanna just help people more and more and more, and there's only one of me. Um, yeah, she does. She'll,
Nice.
I'll be like, "I need an art session on this," or, and we help each other. We do art for each other, and it works really well.
That's
So,
outstanding.
it really is that great. Um, I also, of course, want to not be super Pollyanna. Art does not work for every human being. Why? Because there's nothing in the world that works for everyone all the time.
Correct.
The people it usually does not work for are people who are not motivated to change. So if you are ambivalent, and I see this a little bit with like a chronic illness, for instance. So, if having a chronic illness helps Sally get more connected, she has this group now, she gets online support. Although she hates her chronic illness, there may be a part of her that worries that if she gets better, she would lose that community. That can be someone where it can be a little complicated to do art with because they're not all in.
Right.
Now, you don't have to believe art will work. You can come in and say, I think this is bull crap and I don't think it's going to work. And I'll say, cool, but are you willing to try? And as long as you're willing to, try, then we're good. I have skeptics all the time. I love a skeptic because it doesn't impact their actual outcome. But motivation to change absolutely does. And
So
so,
the person that wants to be in the world of, victimization or something, that person is going to be hard to get out of that, right? I mean,
yeah, for sure. That's not gonna be, easy.
sure.
Um, and there was one other group I wanted to say it doesn't work well for, and now I've forgotten. Um, oh, I was still about unmotivated. So art works with children as young as 5, and my associate Bren Rangel works with kids as young as 5 virtually. And of course, you change it and you shorten it and you make it fun and you add
Get their
memes
attention
and
span, yeah.
yeah, like you do all sorts of things to change it. Um,
Sure.
but you cannot bring your screaming adolescent to art because they're gonna sabotage it, And so
Right.
I say, if a teen, if the adolescent wants to try it, great, but mom, you can't make your kid come.
Makes sense. And then, then they're not able to focus either.
Yeah, it can be a little challenging with people with ADHD, but sometimes we'll just alter the eye movements a little bit. We'll slow them down or we'll shorten them or something. I actually have been pleasantly surprised that I can work with ADHD, especially if you take your ADHD medication before the session. That also does help.
Help us.
Truly.
Right. Yeah. I imagine. Wow. Now that's crazy. Now, what's the longest patient you've had that you kept with? I think you said 12, 13 years. Is that
Yep.
around the longest right
Yep.
there?
That's the longest talk therapy patient. But again, that with that patient, I've done many sessions of art on things that she can't get out of, like OCD.
Mm,
We've worked on OCD behavior. We've worked on suicidal ideation using art. There's nothing, in my opinion, there's nothing that you can't do in art that you would do in a talk therapy session. Meaning, whatever you're coming in for, you are, you want to work on fear of public speaking. Art works beautifully for fear of public speaking. You can work on, as we said, grief, ADHD. It works for dyslexia, insomnia,
mm.
works great for phobias, just absolutely
Wow.
great. I've really helped a lot of people with driving phobia post accident. 1 or 2 sessions, they're back on the road, killing it, loving it, happy, enjoying the car again. Um, and it works great for, flying anxiety, which is really also fun because that can be debilitating for people.
Absolutely. And especially if your job, requires you to travel. And
Yeah,
I mean, people take all kinds of pills and everything, and some people go drink alcohol or whatever they got to do.
right.
Um,
Yeah.
yeah. Well, that's awesome. I mean, so to me, it sounds like anything that you kind of are mentally stuck on,
Mhm.
there is this to kind of help set it free or get you a better fighting chance, right? To go up against it.
Yeah, absolutely. It really is for people who feel stuck. I mean, we have a protocol for like when you feel stuck.
In a
And
rut, yeah.
yeah, and literally, you can't move forward. I mean, I felt people who are like, I really wish I did yoga every day. Like, that's really bothering me. And I'm like, do you want to use art? And, I've worked writer's block. I mean, you name it. Um, I wondered, Brian, if it would be helpful for me, though, to take you through kind of one PTSD case from the military so I can
Yeah,
maybe get
let's
a
do that.
little bit more, because I know most of probably your listeners are saying, how in the world would I make a better scene out of the worst day of my life or the
Right.
worst months of my life?
Yeah, yeah,
Right.
yes.
And so I want to give an example. So
Perfect.
I had a colleague who said, I've got this wonderful man. He's, you know, 50 something. I've been seeing him in therapy for so long. He's lovely. He's doing great. His marriage is great, like all these things. But he cannot stop the nightmares from, his time. I think it was Iraq. He cannot stop the intrusive images. They wake him up at night. He's miserable. They're all the time. They just don't stop. And he's tortured, literally tortured, right? And this was early on in me doing art. So this was a little scary for me because A, it was a trusted colleague, and B, I was like, oh God, I hope I know what I'm doing. But
It's kinda like one
again,
of your first veterans you're dealing with as well?
yes, yes,
Okay, okay.
absolutely. So again, I was like, oh God, let's hope I can do this.
Right.
And I only ended up needing to see him twice. He never came back again. He was 100% fine. But
Wow.
he had had an incident in which he watched one of his best friends get blown up in front of him, next to him, literally next to him. And he had no damage whatsoever. He was completely healthy. And so you're dealing with survivor's guilt, you're dealing with grief and loss, you're dealing with trauma, you're dealing with all of it, right? And then you're dealing with current PTSD symptoms that are pretty severe. So I helped this man see, first of all, I asked how he wanted to feel. If art worked, how did he want to feel? And that's actually very important because you don't always know how people want to feel. And especially with veterans, what do they
Mhm.
want to feel? He wanted to feel just at peace and to lose the nightmares. He
Mhm.
just wanted things to settle so that he could talk about his friend without being tortured, and be to not have it be so disruptive in his life. I said, great, then we're going to work toward that. So, I'm not going to go into any detail, of course, but he used he went through this scene in his mind with no talking, using rapid eye movement. And as you know, way more than I do, he is imagining the worst day of his life, probably. So as he's doing that, he is getting completely dysregulated. He's shaking, he's
Mm.
starting to cry, he's panicking, he's kind of looking like he wants to get up out of his seat. And so those sensations are super negative. So very slowly over the session, his sensations get less and less negative, and we desensitize him to it. He's desensitized, and then what he has to replace the scene, right? That's the part we call it the director. He gets to direct the way he wished it had happened.
Mm.
Well, how the heck are you going to wish it had happened? You would wish it never happened. That
Right.
your friend was alive, sitting with you, and you guys were, you know, laughing about old times. We know that we cannot mess with reality. And so we know that that is not going to be the outcome of his director scene. So at first he does it. And with a director scene, usually right away, you'll start seeing the positive sensations show up in the body. And right away, nothing changed. All negative sensations. He did his director scene. He's not telling me what it is. And basically, we do that. And then I say, are you willing to share anything about how you tried to change it? And he basically said, I cannot let go of these images and what happened to my friend because that is disloyal. And I can't bear to forget about my
Mm.
friend. And I have to honor him by remembering it. And this is what I said to him. And I think you're having some feelings over there. So I want to attend to that.
Yeah, it's
But
kinda sad, yeah, I mean, geez.
yeah, I'm sorry if this is triggering for you. That is obviously not my intention. It's
No,
really
no,
to
no,
try to,
yeah.
yeah, it's really to just try to help people. And
No,
so
for
what I
sure.
said to him is, does your friend want to be remembered for that last moment, which had nothing to do with the way he lived his life? And I get emotional
Mm.
talking about it. And he said, oh my God, I think you're right. And so he replaced it with these wonderful, loving conversations, actually, where he got to say goodbye and tell his friend, I love you. I will never forget about you. This is what you meant to me.
Mm.
And he got to create a director scene where his friend said, go live your life. Don't carry this with you anymore. You need to be set free of this. I love you. Go live a full and happy life. And he replaced it with that, which doesn't change the facts that his friend died. And he
Mm.
needed 2 sessions and he never needed to come back again. And all his symptoms were gone.
Wow.
And so I wanted to share that with you because I can't imagine how complicated grief, memory, and PTSD is for people who lost people side by side and went through horrific things and had to do horrific things as well. But I know that there is always a way through art to get to the other side. If you believe that you are worthy of being set free,
Uh,
nobody wants to be remembered for these last terrible moments of their life.
no, and, grief is it really gets a hold of you, and it can really mess your life up, and that's the hard part about it. The person you're grieving about probably doesn't want you to be ruining your life, right? Like, they want you to be living
Mm,
your best life, I imagine. I lost my dad in 2020, and that was
mm,
the really hard for me because he was like my best friend and my go-to
mm,
all the time. So like literally there'd be moments in time just take my breath completely away from me,
Mhm.
where I just felt like I couldn't even breathe. And
Yep.
I'm like I can't breathe. I just feel like I can't breathe right now
Yep.
because I'm thinking about something,
Yep.
thinking about him, and I'm like, oh, so I mean, it's awesome that there's great things out there like this. I didn't even know there was
Mhm.
things out there like this because
Yep.
I don't know how many men and women could totally benefit from something like this.
Yep. Yep.
And I really hope that the VA and others start to get on board with this kind of stuff. And you know, if this works, like, as rapid as you say it does, imagine how quick they can get some of these people processed and get some of
Yep.
these people back out on the
Yep.
streets
Back to
and back to
work.
work and back on
Yep.
the and then and like open up the system back up to where we can get others seen and things like that. And
We
like
would
you
save
said,
millions of dollars with
it doesn't
something
fit
like
it
art.
doesn't the shoe doesn't always fit for everybody,
Nope.
but the thing about it is we still have to have the shoemakers out there to make the shoe, and if the
Mhm.
shoe fits, then perfectly,
Mhm.
wear it. But the more people we can put shoes on, the less people we have running around without shoes, right? So
Yep.
that part,
I think
it
it
don't
could
even make sense to me.
transcend systems. I think it could transcend corporate America. Think how
100%,
much
because you know
money.
how many people are afraid to get up and do presentations,
Mhm.
and
Or
how
who
people
are
probably
having.
bomb just right on going up and giving a speech because they just, and it's like, wow, you did so good, and then you got up there and bombed your ward.
Right. But also productivity, right? What about all
Sure.
the people who are, having a terrible depression and then miss months of work? Well, if if art or EMDR or somatic experiencing, any of these body brain based therapies were offered even through employee assistance programs, people would be getting back to work. So I think we're not necessarily investing. I think we will. I really do think we will invest in some of this in the next 20 years, but not soon enough.
I might get in trouble for saying this, but I feel like our systems, and especially in the medical department, it's all preventative maintenance. It's really not to
Band-aids.
fix the problems, right? They don't want you to have your problem fixed, because then I can't give you Xanax, that all the mental health pills that are out there now, and some of them actually create even worse mental health issues. But this stuff right here, you're not taking a pill, you're not
And and if
hurting
you
your
are,
body.
you also don't have to stop that. I mean, I
Sure,
actually am
correct.
quite. I do think medication, when used correctly, is transformative because I've seen it in 20 years of practice. People go from completely non-functioning to thriving in a matter of 3 months, you know, but my point, you don't have to do anything. You don't have to stop medication, you don't have to start it, you don't have to stop any other kind of treatments. You can have a talk therapist and go to a few art sessions just to try it out and see if you can't knock out something where you're stuck. And so it's just a great treatment. And again, you know, also props to EMDR, somatic experiencing, something called the Cortina method. I mean, there really are. I think we're headed in the right direction. I actually do. But
I
but it's
hope
gonna
it
take a while.
eventually, yeah, gets more into the mainstream of things, right? And then it's more accessible to the mass. And I would think that this would be a great thing to start with the veteran community, right? I mean, that's a community that's uh, not extremely large. It's a large enough community, though, that you could to get an outcome and to
Mhm.
see, especially most of the military members, they already went in probably with some traumatic problems before they even went into the military. A lot
Mhm.
of people escape their
Yep.
family life and join the military to get out of their abuse or whatever,
Yep.
and military to them's a cakewalk compared to their home life,
Yeah.
right? Now, so like this kind of training and stuff like that, if they could even do it even with law enforcement,
Mhm.
there's just so many different
Oh, yeah.
agencies
I
that could
mean,
use this right now
yeah,
and see
first
benefits
responders.
within weeks,
Mhm.
right? I mean,
First
and it may not be for
responders.
everybody, but you can start seeing it for a percentage, and then we start you start working on that smaller percentage, and then all of a sudden your problem gets less and less, and now we start opening up the doors, and mental health isn't so bombarded because we got to get a handle on this, right?
Yep.
I think we're hitting the level of epidemic when it
Oh, for
becomes
sure.
to a mental health crisis, and if we don't get somewhat of a handle on it, we start finding ways to cure it, bring those numbers down. What does the future look like for us?
Yeah, absolutely. Yeah. I mean, think about, you have a first responder and, uh, you know, uh, she sees something very traumatic and she starts having PTSD symptoms and she can't go back to work. So she has to take, FMLA and go
Yep.
get, treatment. But if we know that that was mostly the incident that caused the disruption in her life, we can treat that incident. Sometimes there's more. Sometimes
Sure.
because again, I do think we all have trauma to some extent at some point somewhere. We didn't experience life the way we kind of wish we had, or somebody didn't meet our needs, and that happens all the time in childhood. We have neglect is huge, even though people don't think that's causes trauma. Neglect is massive. Emotional neglect, which many of us have, is
Right.
actually trauma. Being told, you're stupid, you have to get an A. What happened to that other 2%? You got a 98. I mean, all these things actually can be experienced as trauma. As we said, it depends on the person's nervous system and how they experience it. Because trauma is anything that overwhelms your nervous system. And two people can stand next to each other and experience it completely differently.
Absolutely. Well, let's go through your website real quick. I'm going to go ahead and bring it up. And let's talk about how how people can reach out to you, and if someone had an issue, how do they go about looking into this and getting themselves the help they need?
Sure. So, I work with people in the DC, Maryland, and Virginia area, accelerated resolution. You can go to my website, brookebralove.com. I have one practitioner who can see people in all 50 states. And I have another one who's also seeing people in person and virtually in Maryland, Virginia, and Pennsylvania. So we are here for you. But also, you can go to acceleratedresolutiontherapy.com and you can do a search for art practitioners by state. And so I would absolutely encourage people, if wherever you are, there are think I think it's 13,000 art practitioners in the US, Canada. I think there's some in Australia, but predominantly the US. And search for them by state, get on the phone, talk to people, and learn more about it. And if art is not offered in your area, then certainly look into EMDR, which is more common. And it's because it's just been around longer. It's not necessarily more effective, it's just been around longer.
Hmm, that's awesome.
Yeah. And folks can also follow me on Instagram at Brooke Bralove Psychotherapy. I've got lots of fun reels. I talk about art constantly on there. So you can find out more.
Yeah, because you know what, you really got to educate us because this is very new and very beneficial, right? I mean, it, I see how excited you are about it, and you were a patient of it. And
Mhm,
like I said, you believed in it so much that you wanted to become the teacher. You want to be the person that to teach them
mhm.
how to get through their trauma, their past and stuff, because it worked really well for you. It's awesome to see it. Now, where do you see this going? Like, I mean, where do you hope to see this technology and all this going with the way the world's working?
Yeah. Well, I think I really do have kind of, ambitions to, try to infiltrate corporate America a little bit,
Yeah.
um,
Even the
because
law enforcement and the fire stations like that, I mean,
Mhm.
that would be
Yeah,
great to start even in just your community and
exactly,
see if
right.
that works,
Hey,
right?
yeah,
Yeah.
yeah, I mean, again, I think you can start anywhere. Right now, my focus is creating a practice of art practitioners who, love art and love to deliver art, and, I'd like to have a few more in-person practitioners in the Bethesda office, and really just get more and more people excited. People are starting to hear about it as a trauma therapy, so it's up and coming is how I would describe it.
Yeah, it's one of those new very new type of things, and with that, I imagine you gotta get people to believe in it, right? And
The
the
science is there. The
and you
science
just
is
gotta have
there.
testimonials, like, people have gone through
Yep.
it and just like, "Hey, you're one of them."
Mhm.
You can speak for yeah, speak for yourself that it works, great to so much that you like I said, you found the love to go and learn it. Now, did you have to go take certifications? How did you get to that level?
Yeah, so, art, there are two levels. There's a basic level and an advanced level. And the basic training is 3 days. And after 3 days, you can begin doing art. And
Oh,
so, what I love about that is it's not, these huge, feats and things to jump through. A lot of certifications are years and years and years, and frankly, I think it deters people from being trained. But art is accessible. There are trainings all over the country. Again, if you go to acceleratedresolutiontherapy.com, so any therapist listening, you can get trained in 3 days. And then there's an additional 3-day training for the advanced level. And you can do
oh,
that at any point after. And of course, I have both.
nice. Now, is there a lot of you guys out there, or
As
I
I
mean,
said,
is it
I think it's
starting to
about
grow?
13,000.
Oh,
I've
13,000.
heard
Okay,
it's about
okay.
13,000. I haven't gotten an updated number,
It's a pretty good number.
that
I
recent.
mean,
Yeah, I mean,
I
we're
guess
getting
in
there.
comparison with the country, it's not a lot, but I mean, that is a good number.
Yeah, yeah.
So it
So,
does sound like this is starting to catch on, and people are starting to get as excited as you are.
yeah, yeah. I cannot, contain my enthusiasm, that's for sure.
No, I was literally you talk about it with a smile and very upbeat about it. So I'm really appreciative of you coming on and taking the time to talk all about that kind of stuff. Is there any other things that you want to talk about, or anything you may have forgot that we didn't cover?
I
You-
I think
or
the only thing I want people to know is that there's hope in exploring non-traditional ways. I don't always, and again, I am a talk therapist. So, I've been doing this for 20 years. I believe in talk therapy. I believe in the power of a human relationship connection to be healing. But for certain trauma that is stuck, nothing's going to get at it unless you're working on a brain and body level. So don't be afraid to ask about other types of treatment. And also, I think psychedelics are going to get bigger and bigger and bigger here as well. And I
the
also think that's
microdosing
another
of
way
like
in.
yes, yep.
Yeah, anything, microdosing, doing, ketamine, psilocybin, MDMA. I think a lot of these things are also transformative. And I think all of this is going to grow. because it's
Right.
about the
I'm glad
broken.
that I think that, I think we're starting to get in that world of where people taboo about it, right? Like all our lives, it's always been so taboo. Now we're starting to see, oh boy, we're starting to bug out here. I don't know if you lost me
I
there
saw
for a
that.
second.
Yeah.
But we're starting to get into a world of seeing the healing powers of certain things that all our life we're like, oh, stay away from these things. But we're starting to see some healing agents. So I'm glad you actually mentioned that, because I do have
Mhm.
another podcast that I produce. It's called Sick Call with Doc, and what they talk about is the natural ways of healing, like
Mhm.
medical marijuana,
Yeah.
psilocybin, and all that stuff, microdosing. It's
Yeah.
just educating people and trying to get everybody aware of different ways now. Like we've all been taught so much of like X, Y, ABC, XYZ, 1, 2, 3. But there is some other, other things out there that we're starting to see that are not so what
There are
we're used
different
to.
avenues in, and we need to explore every avenue to find out if there's some gold there.
Absolutely. And you know what? What's wrong with having a couple extra tools for your toolbox?
Exactly.
And that's the way I look at it. It's just another avenue to gain some tools, and that's what we all need out here.
Yeah.
All right. Well, I thank you once again so much for coming on and sharing this great. I've never heard of it, so I'm very intrigued by it, and it's definitely something I will be looking into more as well. And I would love to see this more in the veteran community as a possibility for
Mhm.
men and women to get some help. And
Absolutely.
I don't know why the VA wouldn't look into something as such like this, and then take some time and give it a trial. Hey, let's give it a 3-year trial or something, and run some cases through and see what it does. If it don't work, boom, go back
Right.
to your old way that don't work. So
Exactly. Brian,
uh
thank you so much for having me on. I
yes,
really enjoyed it.
thank you so much. And I'll go ahead and let you go back there and enjoy the crayons, but thank you so much, and have a great one. All right, friends and family, thank you guys so much for once again for joining me. And don't forget, if you guys have Spotify, Apple, any of those, please rate the show. It will definitely help us get these amazing stories out there and other great, things for us to get on the healing venture. And I know for me, it's I'm in my 40s now, and it's taken me a long time to try to get on this healthy path, and it's all from the mental to the physical, all of that, because I would love to give the world the best version of me. And so there's people out there like Brooke and others that want to help others get to a good place in their life to be the best versions of ourselves. So we appreciate people just like her. And I thank you all so much. And I hope you guys have an amazing day. And you know how we say, don't let the day kick your ass. Make sure you're out there kicking it. Till next time, we'll see y'all.
Thank you for watching. Please like and subscribe.